Hello, everyone. My name is Dr. Sonal Chandratre. I'm a pediatric endocrinologist by background. And today I'm going to talk about a clinical practice guideline that was published on January 9th, 2023 by the American Academy of Pediatrics, um, outlining the evaluation and treatment of children and adolescents with obesity. Now, the reason I'm doing this video is because many people are interpreting the content of this AAP guideline as to saying that this guideline is recommending pharmacotherapy, which is medication for obesity, and bariatric surgery for patients, and showing a more aggressive approach. Now, I'm doing this video to clarify the guideline. I just want to have a disclaimer that I'm not a speaker for American Academy of Pediatrics, but I'm speaking for myself as a pediatric endocrinologist who takes care of patients with weight management in my day-to-day pediatric endocrine practice. So first and foremost, I wanted to share with you what is the why is AAP or anybody else even talking about having a guideline of evaluation and treatment options for obesity. So it's important to understand that based on the current CDC guidelines from 2019, the obesity rates for children have increased to about 15.5% nationally. And there are multiple states throughout the United States who have childhood obesity as a major problem. It's important to understand that 1 in every 6 youth have childhood obesity. So it's really important for us to talk about this. Secondly, since COVID-19 pandemic for the past 2 years now, the problem is because of the COVID-19 restrictions, children were limited in terms of being in a home setting, even for their schooling. Now that the schools have started since last year or for some this year, children are still not completely participating in activities, and that has led to incorrect and improper lifestyle, and that has compounded pediatric obesity. I also want to go ahead and say that if COVID-19 pandemic was not there, isn't it everybody would have wished that it wasn't there, then pediatric obesity was the #1 pandemic across the world. So that is why we are having this discussion about childhood obesity. And that is the reason why American Academy of Pediatrics even wrote a guideline on treatment plan and evaluation. So first and foremost, I want to also talk about what obesity is. So obesity in children is defined as a body mass index above the 95th percentile for children and teens of the same age and sex. That is important to note. What is being overweight? Overweight is if you're above the 85th percentile and below the 95th percentile, that is being overweight. Now, what is considered as severe obesity? If your weight is more than 120% of the 95th percentile, then that is considered as severe obesity. So this was more like a general understanding about obesity. Understand that obesity is a complex chronic condition that has multifactorial contributors. So there's genetic, physiological, socioeconomic, and also environmental factors. Understand that there are 2 different types of obesities: pathological obesity and non-pathological obesity. Pathological obesity means the reasons or the etiology of that obesity is either you have some sort of endocrine hormonal concerns, and I'll give you some examples. If you have an under-functioning thyroid, then you have weight gain. And if you make sure that your thyroid is appropriately functioning, then you have an appropriate weight. So that is a different form of obesity. Or if you have excess of steroid in your body, that can also lead to obesity. So this obesity is not what we're talking about. Non-pathological obesity is mostly nutritional. So we just talked about genetics, physiologic, socioeconomic factors, environmental factors. So these are factors for the nutritional obesity. So understand that even if you're genetically predisposed to having obesity as a child, understand that, in fact, that gives you a reminder to make healthier choices and prevent obesity. So always remember, prevention is better than cure. And that is why we need to work on our lifestyle choices. Also, remember, childhood obesity is not really equitable, which means there is disparity in this particular disease. So studies have shown that children who have lower socioeconomic status, or those who have stress and concerns in their family life, or who are subjected to bullying or racism, children who are having immigrant parents or are themselves immigrants, or are from minority population in terms of ethnicity, also are more predisposed to obesity. So as you see, there are multiple reasons why you would have obesity, and that is why it's important to note that an approach to support your child, if your child has pediatric obesity, that approach is going to be more customized. So understand that these guidelines should not be misinterpreted. And it's not that American Academy of Pediatrics is saying that every severe obesity child who has, every child who has severe obesity should have pharmacotherapy or should go for bariatric surgery. Instead, what the guideline is recommending is this opportunity should be used as an opportunity to have further evaluation for your child if your child has a BMI more than 95th percentile. So understand that you got to look at it in a holistic way and then decide what needs to be done. And yes, to some people, this would be an aggressive approach where the only glaring thing that they see is, well, the AAP is recommending medications for a child who has obesity or bariatric surgery. And I don't want you to rush to your pediatricians with this guideline and saying, well, prescribe us a medication, or my child needs bariatric surgery. I don't want you to do that. I want you to trust your clinicians, your pediatricians, and your pediatric endocrinologists to then give you an appropriate advice, because understand that this guideline is merely a plan, sort of an escalation plan of what should happen if nothing is really working. In olden days, traditionally it was not kind of offered to children in terms of bariatric surgery. But if there are certain situations where your child needs it, then obviously as physicians, we are going to recommend that to you and kind of offer you. So I want everybody to know that AAP is not discounting the importance of lifestyle modification in any way. Lifestyle modification is and will always be the major factor or a positive contributor in your child's journey toward a healthy weight. But definitely there are certain additional considerations, such as pharmacotherapy and such as bariatric surgery, that would also be kind of utilized by your clinicians. So I want you to understand that, and I want you to understand the actual process. So understand that if your child is having a regular annual well-child exams performed by your pediatrician or your family medicine clinician who takes care of children, then they every time identify what your child's body mass index is, and based on the body mass index, they would give you appropriate advice. Now, let's say, for example, your child's BMI is in the range of obesity or severe obesity. What would happen next? Typically, your pediatrician is going to, in addition to giving you a healthy lifestyle advice, is going to refer you out to a pediatric endocrinologist or nutritional services, or a more of a comprehensive program that has all of these stakeholders that I just mentioned. And once you are evaluated, let's say, for example, in my case, if as a pediatric endocrinologist, I review your child for childhood obesity, then what do I do? Obviously, I go through everything, and the most important thing I do is I also look for comorbidities. Now, what are comorbidities? Comorbidities are certain healthcare conditions that coexist along with obesity and further worsen the health outcome for your child. So remember that what are we doing as part of evaluation? We're not, if we as pediatric endocrinologists or even pediatricians for that matter, if we're giving you the advice of following lifestyle modification, which is the first step for most of children with obesity, then that's not wrong. It's not, we're just watching and waiting, because again, that is also a statement that is coming out from this guideline taken in a wrong sense by some people, where previously, as if it's indicating that previously clinicians were just waiting and playing the waiting and watching game and not really intervening. So that's not the case. When we say that we are watching and waiting, what we are also doing is we are assessing and evaluating your child who has obesity for other conditions, health conditions. So let me give you some examples. We evaluate for whether your child has high blood pressure, called as hypertension, or if your child has lipid disorder, which is increased triglycerides or cholesterol, or any derangement in your child's lipid profile, any abnormalities with the liver functioning. We also assess if your child has prediabetes or diabetes. We assess that as well. And we also look for your abdominal circumference and see if you have predisposing factors. We also look at any sleep issues, such as obstructive sleep apnea, because if your child is having obesity, there's a chance that there's a lot of fat pad around in the neck area, and especially at night times, your child may be snoring a lot and has a predisposition to obstruction at night, and unfortunately leading to an unfortunate death due to that fat padding. So we evaluate for all of this. In girls who are of menstruating age, we also assess if your daughter would have polycystic ovarian syndrome, also referred to as PCOS, and the symptoms are menstrual irregularities, and so we also assess for that. So if you have these pre-existing comorbidities, such as these conditions existing along with obesity, then these are the scenarios where, as a pediatric endocrinologist, I would certainly offer your child a pharmacotherapy. And that has been ongoing even before the release of these guidelines. So I wanted you to know that that is happening. In certain severe cases, we also recommend bariatric surgery when that's the only option. But always remember, for the most part, that is a rare recommendation and suggestion. We still continue to advocate lifestyle modification. And the way I do it is I use a patient-centered approach, a family-centered approach, where I make sure that your child and you as a family are involved in the decision-making. I have an extensive use of motivational interviewing during my visits, where I try to channelize the inner motivation of your child and make those choices with it. Because if I were to make a plan and just prescribe that plan for you, the likelihood of that not happening is much more, and for the lifestyle modification interventions to fail is much more. So that is why I use this technique of motivational interviewing, where I engage your child and you as a family, and I support you in your own journey, and I support your choices in formulating a goal, so that the chances of you following your own plan is way higher. And I ask you how motivated you feel on a scale of 0 to 10. So again, you as parents can also do the same thing for your child who you think is struggling through a healthy weight journey. So this is what we do. We make sure that we engage, we have plans, and for the most part, I would say lifestyle modification fails is because it's not done appropriately and not enough time and education is put in. So I certainly would encourage parents, even healthcare workers, pediatricians, family medicine physicians, and my other pediatric endocrinologists to spend a lot of time with children and families to understand their challenges, and have that approach where you're understanding why somebody is not able to make a positive change in their lifestyle, and to support those challenges in a human-centered design approach, and not just kind of prescribe it in that way. And again, I've seen through my practice Giving them time really helps because that gives them an ability to share their concerns and to kind of work out a longer plan, which is more customized to your concerns and problems. So that is what happens in weight management. And always remember, if your clinician is not asking or not recommending you to take medications, then that there's a reason for it. And if they are recommending a medication, then there is a reason for that as well. So I want you to really understand the importance. The big highlight of this discussion is to understand that there is no single medication or surgical intervention that can completely eliminate obesity. So it has to act as an adjunct to lifestyle modification. And yes, in some situations, we see that lifestyle modification fails, and there could be several reasons for it. And you identify the causes and you support the families and children throughout their healthy weight journey. And if needed, based on coexisting comorbidities and the situation, then you prescribe medication and understand that there's no set rule. Yes, many of them talk about trying out lifestyle modification for 6 months to a year, but it all depends on how you're progressing, how your symptoms are progressing, how the weight or the obesity is affecting your quality of life. Like, for example, if I know that somebody has sleep apnea and is at risk of dying, then obviously I'll be more aggressive in my management and will closely monitor the changes and how we're doing in terms of our healthy choices. So there's a lot that goes in, and I don't want families to get worried or just take 2 or 3 sentences that the guideline is recommending and take it out of context and say that this is what AAP is asking the clinicians to do. Now, I want to kind of sum up this discussion by sharing with you, as parents, what could you do at home to establish these healthy habits in children. I can have a different session, a different video on that. But the most important things I'll mention here is to remember your child is having 5 fruits and vegetables, and preferably trying to use different fruits and vegetables from the color of the rainbow. So I always say that eat a rainbow, and that's always really healthy. Make sure that you are watching under 2 hours of screen time, because that also has led to increased obesity in the world, and it's taking away the time for children from different hands-on value-added activities. Make sure that you're exercising at least 60 minutes daily, and you could separate it into different chunks, but it has to be an activity where you feel that your heart rate is going up and you're having, you're having an activity and not just, walking around, not just getting up and going to the kitchen. That is not considered as an activity. And last but not least, making sure that you're having zero sugary drinks or sugary foods, because that again contributes unnecessarily to excessive weight gain when it's a simple way that you can avoid obesity. Also, remember that you should follow portion control. You should include healthier options, healthier choices in your diet, appropriate amount of grains, multigrains, appropriate amount of protein, lean meat, pulses, lentils, all that good stuff, and appropriate amount of dairy, again, low fat choices, and also healthy choices and smart choices, because that's going to give you nutrition and also kind of help you in your healthy lifestyle journey. So again, the most important thing is families and guardians the way you should have these discussions around healthy weight with children is make sure that you're not playing the blame game, you're not being judgmental, and you're not stigmatizing this conversation. This conversation cannot only happen in the 4 walls of the hospital. It has to be happening in the school setting. It has to happen in the home setting. And this should be a kind of a safe environment where children can come and ask you questions about how to make these healthy lifestyle choices. And again, as parents, it's really important and high value if you act as role models and make this as a family health initiative versus just your child who may be struggling with weight management. So it has to be a collaborative effort to make these healthy lifestyle, and we got to continue to educate our children, bring in that awareness and about healthy lifestyle. Also, I wanted to share with you a great resource on healthy lifestyle. This is a book that I've authored, and it's called Kids, Come On, Let's Get Healthy, Complete Kids' Guide to a Healthy Lifestyle. And this is going to be really helpful for all children. It's available on Amazon. I'm also going to have a link below in the description box. And this is available on Amazon with this name. And I'm just going to flip through things, and you can see, how informative this is. It tells you about choices and is really talking about different important things that your child would really find helpful, highly interactive, kid-friendly. And this is actually the key for prevention of obesity. We don't want our children to just randomly get to a stage where they have to go through pharmacotherapy and bariatric surgery. So this will act as a vaccine. This is the only book that is available, written by a pediatric endocrinologist, based on my experiences and working with children who struggle with healthy weight. And like I said, it's kid friendly with beautiful illustrations. And so it's really important for your child to have a guide where they can follow and that they can use this as a resource to get information, because again, adults have all the information available at their fingertip, but it's really important for kids to have something that they can refer to anytime they want. This is a great read, and I will highly recommend this book for every child, not just somebody who is struggling with weight, but for every child to be successful in their life and in their health journey. So thank you so much for watching this video, and really appreciate your information. Thank you so much for joining in today. I really appreciate your time. And if you like this video, please subscribe to this channel for more videos regarding health, and share this important information with your friends and family. Thank you, and stay healthy. Bye-bye.